Good evening, friends. Here's your friend Dr. Deepak Chaturvedi again. And today I'm going to talk about diabetes management in this lockdown period. I'm very sure that if you are diabetic, you are taking care of your blood sugar and your diabetes control very well under the supervision of your physician and your doctor. But as we all know that it's a lockdown period and most of us are locked down in our homes, so definitely our physical activity has gone down. The cues of eating, the smell of food is around us in our home, which is tempting everybody to eat. I'm sure everybody is putting on weight during this time. So hence we are expecting an epidemic of uncontrolled diabetes in coming days. We all have to be very cautious now and we have to control that. It should not happen that in this epidemic of corona we ignore our diabetes and and we save ourselves from corona, but we get the complications of diabetes. Now for diabetes, whether it is lockdown or no lockdown, what we have to take care, there are 4 pillars of diabetes management. It is just, you can just keep in your mind the 4 pillars of diabetes management, which we all need to be compliant of and to take care of those 4 pillars. Pillar 1 is the food intake, what you call as your diet. Pillar 2 is your physical activity, we can say as your exercise and other things. Pillar 3 is sleep, a proper sound sleep. And pillar 4 is your medication. Insulin, no insulin, whatever it is, but your medication as per your physician, your diabetologist. Now very important is, whoever is able to take care of these 4 pillars is the one who manages diabetes very well and prevents the complication. Somebody who is not compliant in one pillar has to be very rigid in the other 3 pillars. For example, somebody is not able to follow the dietary protocols given by the physician and the diabetologist. He or she has to be very strict on the exercise regime, sleep, and in medication. Somebody who is not able to take care of the sleep should be very rigid about the dietary protocol, very rigid about the exercise protocol, very rigid about the medication. The medication may be more in these people. Somebody, say, probably not able to take care of the physical activity. Now what is happening in this lockdown period? These people have to be very rigid about their dietary intake, very rigid about their sleep pattern, and should be very rigid about their medical intake. Somebody who really want to be on minimum medication, say everybody wants to be on minimum medication, those people should be very rigid and very compliant on their dietary protocols as per advised by their physicians and diabetologists, should be very rigid about their exercise regime, and should be very rigid about their sleep pattern. So what should be followed? So let's go all the 4 pillars one by one. Diet. Basic principle. Eat less than your hunger. Don't eat compulsively. Don't eat impulsively. When I say compulsively eating, that means that somebody is offering you food and you cannot resist it. You cannot say no because of whatever your obligations are. So don't do that. So don't eat food out of time. Impulsively is that you are sitting and you feel like to have a chocolate. You suddenly feel like to have a gulab jamun. Please don't go for it. So no compulsive eating, no impulsive eating. Eat less than your hunger. Don't eat till full stomach or till you are burping or you are belching. Don't do that. Have 3 meals a day to start with. Be very clear. Your breakfast at about between 8 to 9, your lunch between 1:30 to 2:30, and your dinner before 8 p.m. should be done. Avoid sweets, avoid sugar as you know, and very importantly, avoid the fried food. Don't fry the food. I'm not saying you are not going to have oil or ghee in your diet, but don't burn oil and ghee, because as soon as you burn them, then you are inviting the negative part of the oil and ghee, what we call as a trans fat in your body. So don't fry them. So 3 times a day meal, less than your appetite or your hunger. No sweets, no fried. Encourage intake of vegetables. Have enough vegetables in your food. Try to stay away from the refined sugar. So this is about your food. Don't right away go to sleep or lie down on your bed after having your dinner. Now comes your exercise thing. I know that you are not able to go to gymnasium or go in the open garden or a ground for a walks and all, but at least you divide your 40-minute daily regime over a period of say 16 hours in a day. So every 2 hours do 5 minutes of some intensive exercise. You can do your pull-ups, you can do your push-ups, you can do your planks, you can do your skipping, whatever way. You can do your yoga. 5 minutes every 2 hours. Do that. It will, even it can be a mean to pass your time also at your home. So this is about exercise. Third is sleep. Now you have got a chance to sleep on time. You have got a chance to wake up on time. Try to sleep at 10:30 in the night and get up at 6:30 in the morning. So you will have the whole day with you. And 8 hours of sleep is what is optimum for anybody. So have these 8 hours of sleep. Then comes your medicine. Please take medicine as prescribed by your physician, your diabetologist. Don't play with the medicines by yourself. Okay, don't adjust the doses by yourself. You may be socially distanced, but not digitally distanced. You can always take the phone, call your physician with the prior appointment or with the prior permission. You can send WhatsApp, you can send the messages, and you can convey. You can check your blood sugar at home. You can check your blood sugar. Maybe ideal is to checking 6 to 8 times in a day, but I know that you should not prick yourself so much, but at least check your blood sugar 2 to 3 times a day. Check your fasting almost every day. Inform your physician so that your doses can be adjusted if needed. Check at least one postprandial every day. So at like one day you can check 2 hours post breakfast, one day you can check 2 hours post lunch, one day you can check 2 hours post dinner, and someday you can check in between random sample. So that's how 2 samples a day, even if you are checking and informing your physician, it will be easy for the physician to adjust your doses. So if you can really follow these 4 principles of the 4 pillars of diabetes management, the food intake, your physical activity or exercise, your sleep management, and your medical management, I'm sure you will sail through this lockdown period without having hypoglycemic crisis or hyperglycemia both ways, and your diabetes will be very well controlled. And when you come out of this lockdown period, you will be in a better situation of compliance and discipline, which will help you in your life further. So with this, I conclude my video and would again come back with some other ailment, some other disease, and other suggestions of mine in my other videos. So stay tuned, friends. Thank you so much for watching. Thank you. Bye bye.